Hello. There we go. Good afternoon, everybody. My name is Shauna Ginsberg, and I'm Manager of Support and Education Programs at Rethink Breast Cancer. And I'd like to bring up my fantastic panel now for the silence of breast cancer, Preja, Hanan, and Sarah. Come on up, guys. So I think we'll start just by getting each of you to just talk a bit about yourself and just tell the audience a bit about yourself today.
Good afternoon, everyone. My name is Sarah. My husband and I, we came to Canada at the end of 2006. I was diagnosed with breast cancer in August 2009. I had surgery, chemo, radiation. I joined. I became a peer support at young women with breast cancer in 2011, and now I also involved in other two Mandarin-speaking cancer support group.
Thanks, Sarah.
Hi, good afternoon. My name is Preja. I'm from Nepal. Back home, I'm a physician. And I'm here in Canada since 1.5 years. And I've been working in a community management in a healthy living program. I have done my master's in public health from Thailand before coming here. Thank you.
Hi everyone, I'm Hanan. I'm from Morocco. I'm a family doctor and I came to Canada in 2009. I'm working at Community Matters as a program coordinator. Our program is for seniors, and we call them Adult Plus because we don't like the word seniors. Yeah.
Thank you all. So I think I'd just like to start by getting your first impression of the film, and the name of the panel is The Silence of Breast Cancer. So maybe each of you could just speak to what that actually means for you, the silence around breast cancer. Anand, do you want to start?
So silence, the title of the movie is really reflecting the reality, because it's really, whenever we don't want to talk about breast cancer, we don't want to talk about our breast, we don't want to talk about cancer. So it's really reflecting the reality, and it's something going on in all the cultures. It's not here only in Canada or in Canadian culture, Moroccan or whatever. It's everywhere the same thing. So I believe it's time just to speak up and say no more silence. We need to talk about our breasts. It's private, that's right, but still, when there is something hurting us, we need to talk about it. Yeah, this is my thought.
And I like to add, we are the one who is looking after our family, whether we are from some profession or something. But for the first, we are women, and we are the one who are responsible for our children, our husband, and our parents, and everything, right? So, if something will happen to me, then who is going to look after my child, or who is going to look after my husband, or I'm something like a kind of a power in the family. Like when I'm destroyed, then everything will destroy. So I think it's the time for us to talk about the breast cancer freely, and even in the community or in the society everywhere. So I think it's the right time.
It brought lots of emotional feelings too. While I was watching the film, because of the occupation, so I talk about the breast all the time, especially after my treatment. But in our society, I think there's a lot of women they would like to wrap it after the treatment, after all the things. They would like to wrap it, leave it alone, and pretend like nothing happened and move on. But I like to talk about it not because I enjoy it. It brings lots of pains every time. Even now, I talk about big C. I mention the word lots of times every week. Every time I feel there's something still here. But if we could bring, more awareness to the community, we could, even help one more people. It's worth doing it because we don't want to see it happen in more and more family. So there is silence, but I guess it's worth doing something, even if there's pain involved.
Thanks, Sarah. Pooja, I just want to go back to something you said, just about women being the caregivers and thinking about what's going to happen to their families. So for many women immigrating to a new country, their health is not their highest priority. Their priority is getting their families here, it's getting settled, it's finding employment. In some cases, it's bringing other family members to Canada as well. So in fact, it often takes a back seat to the needs of their family and their community as a whole. What would help these women understand that their health must come first in order to care for everybody else in their lives?
In my opinion, what we can do for them is it's because of the ignorance. Some communities because of ignorance, or in some communities because of the cultural beliefs, or it's a kind of taboo. We shouldn't talk about the breast and everything, right? So it's for the immigrant. The first thing is those who are housewife, or it's detrimental for them to come here and settle and everything. So what I think is we need to approach them which by any means, right? We are working in the community matters, we are trying to approach them in a way the language which they could understand, or we can talk about the breast cancer with their friends, or with the communities that they can afterwards they can go and talk with their friends and ask them to come and approach for the healthcare systems or whatever is available in the community for them. So it's basically, I think we need to empower them. We need to give the health educations. We need to give we need to tell about what is going on in the society, or what are the things they can get. We are providing for their support. So I think as we are trying our best, we need from them also the positive response.
Anand, do you want to add to that?
Yeah, I would say we need to emphasize on the importance of health. Okay, so for sure, as immigrants or new people coming to Canada, we are facing different barriers. And first of all, the language, and there is the settlement part. We are looking for a job, so we don't think about our health. But we need to know something, and for that, I'm going to give an example. It's about myself. I have a vitamin D deficiency, and I believe many people, they have this deficiency. So if I don't take my vitamin D, it's pain in my muscles, my joints, so I'm not able to do anything. I can't care for my kids. I can't do my personal stuff. So the way I'm encouraging myself to take my vitamin D, I just think, okay, I'm not going to be able to do this and this and that, and I need to do that. I'm not focusing on the complication, what's going to happen after that. No, I'm just focusing on the things that I want to do. So in this way, if you focus on your health and you just think many times that you need to be healthy, not only for yourself, but for your family, for sure, you're going to just take time to think about your health.
But how do we get other women to start thinking about their health?
So this is our responsibility. For example, in Community Matters, we are really focusing on that. We have different programs, and many people are coming, for example, for Job Club. So they are looking for a job. They need to work on their resume. They need to improve their skills. Okay, this is important to get a job. But if you are not healthy, you will never get this job. You will never survive. So work on your health. Take care of yourself. And then it's going to be easy to achieve whatever you want. Because if you are not healthy, for sure, you will not do anything in your life. It's not only about caring for your family or, earning money. It's for yourself. How do you feel, We are really important. I know as women, we think for the kids, for the husband, for the groceries, for my studies, I think for everything. But still, if I'm not healthy, I'm not gonna do anything of that. I'm not gonna achieve any goal. So I need to take it in this way. Just think about the positive things that I'm gonna get if I'm healthy. And then it's gonna be easy for me to get whatever I'm looking for. I don't know if I was really clear just to explain that. So it's like what I said for the vitamin D. I don't like tablets. I hate that. But I know if I'm not taking my tablets, this is what's gonna happen. I don't wanna reach that level and be like sitting without doing anything. So I'm just taking my vitamin D. So this is the point. Let's see. I don't wanna like to go and see my doctor. I don't wanna talk about my breast. But I know if I don't do that, and I'm gonna be diagnosed one day, but it's gonna be too late. I don't wanna be at this stage. I wanna be diagnosed early so that I can get the best treatment, and I'm gonna have more chance to be treated and cured.
So with that, what can organizations like Community Matters or even bigger organizations like hospitals do to help promote that?
Yeah, like in our organization, what we are doing, it's like providing programs in an informal environment. So let's see, we are talking about breast cancer today. Instead of being formal, like having a doctor, speaker, you know, somebody who got really the knowledge to talk about breast cancer, no, we are training our people. It's Toronto Public Health, for example, who is coming to us, delivering training sessions for us, and we are the peer leaders. So we are just, it's easy for us to communicate with our people. It's easy for me to talk about cancer with people from our community, because I know their culture. I know how they are perceiving the message. I know the way to talk to them. It's not about bringing this academic knowledge. You know, cancer, it's about this cell and this is what happened and there is this stage and that. I know that stuff, but it's not gonna be helpful when I'm talking to people. You know, we wanna create this informal environment when we talk about health. I mean, I have a breast, you have breast. There is no difference when we are talking about that. Yeah, we are covering that. We don't like to talk about it, but still, between women, we can talk about this freely and openly. There is no problem to talk about our private parts. This is about how you are talking to people, how you are communicating. It's the language, we know it's already a barrier, so we need to make it really easy and clear when we are talking about health issues. Because the system is here. We have our health system. The system is providing services. But are the people using the services? No. We need to work on that. We need to encourage people to go and see their doctor, to seek their advice. We are not professionals.
Right.
Okay? I'm in qualifying. I know that I can't give advices, but at least I can encourage people living in my community to go and see their doctor. And if they are not able to do that, I'm going with them. This is the way we are working in Community Matters. We are just trying to escort those people who are not able to do that.
Mentoring them. Sarah, what was that like for you with English not being your first language when you were diagnosed? And I believe you were seen at Sunnybrook, right? Yes, so maybe you can talk a bit about that, whether there were enough services in place or whether there were any barriers to communication when you were diagnosed.
Well, there's a lot of services being provided to either newly diagnosed or being a lung cancer patient. But most of them, I would say 100% of them, well, I was being offered at Sunnybrook, they are all like English-based. So it was okay for me to, you know, involve the program, see how it goes, but still I don't have that fully feeling of belonging, because when you go, they're all blunt ladies like you. And later on, you know, while I was waiting at hospital, there's sometimes I could saw some Asian face like me. I would talk to them about the young women with breast cancer, such wonderful program. And normally, first question they would ask is, are they English? Well, yeah, then I don't think I could go because I don't understand or I don't feel, quite comfortable. So that's how we kind of informally outreached to our community people to use our own language, just as the doctor or the lady said in the film. Like, you have to be very cautious about what we are offering based on the ethnic variety.
So that's my next question. So we know that there's a need for design and implementation of culturally sensitive breast health information. It's not enough, I think, just to translate what we have available to the general population. So often hospitals will just translate directly instructions. Maybe you can speak to this issue a bit, why it's not enough just to translate and how culture can play into that. Preja?
Okay, as we said, like this is a very private thing for the woman to talk about, and we feel even we feel shy to talk about this with any other people or any other guy beyond our friends and all. So, what will happen is that suppose like you are provided the family doctors, okay? So maybe you go to your family doctors to talk about, but what will happen, like if the family doctor is a male doctor, I felt a little bit of hesitations to go and talk and to expose my breast in front of him. Even like I'm from a medical background, I felt so. So what about the other people, like they are who are very ignorance or lack of education, or like those people with the cultural backgrounds? We have the taboo, like the students, so they're exposed to their private part and all. So it is very difficult and to convince them, like no, it's about your health. You don't think about where you are going or where to whom you are exposing. You have to think about your health first, then you have to get medicines for that, or to get cure of your disease and all. It's very difficult to convince. So I think like only the flyers or like translating them in their language, the language they can understand, is not only enough. We need to empower them. We need to teach them like their like your health comes first, even for you and for your family. It's not only you think about your family. When you are not there in family, the family is going to lost a lot of things. Not only you, and then like it's and when you are um you got disease, it means like it's a burden for yourself, like it's a burden for the family also, financial burden, emotional burden, so many things are there to be considered. So I think like it's very hard for the physicians because they don't have time to talk about this. They have a lot of patients, they have a lot of appointments to be fulfilled on time. So but we from the community labels, I think like we can approach to those people, these kind of people, and then talk about their breast, and talk about at least they can do their self breast examinations and all. So if they'll get some lump or something, like they can approach for the health care provider. So I think we can help them from the community. So
I was just going to ask that question, like whose role is it to actually inform and educate physicians and other healthcare providers about, culturally sensitive issues or different needs of their patients?
it's not about like who is responsible for this, or like who is responsible to go and give education to them. It's about like everyone is responsible for this one, I think so, because it's about my health, it's about your health, it's about your family burden and everything. So you have to think about your health. You have to be healthy to look after your family. So it's not about only the physicians. They don't have that much of time. I agree with that, but um, still they are helping us. Like if when they took our family history and everything, and they knew that we are a high risk group, or my family, somebody from them, my family have breast cancer. So obviously they are going to say like, you have to go for the screening program like this, like this. They are going to explain everything. Everything. It's not only the government should go and talk about this and so all those things in the televisions or talk about this in the radios, or physicians should talk about this. No, we, every one of us are equally responsible for this, I think so.
Uh, I think when we think about breast cancer, this is, as Brija said, it's our responsibility. But we need to make it clear, like, we need to divide the responsibilities in order to be sure that we're going to get good outcome at the end. I mean, physicians, they have their own part. They are dealing with the disease, they are referring the patients, they are asking for other investigations when there is something wrong. So we can't ask the physician to run this kind like of education session. So I feel and I believe that the best staff that can do that is whenever we're talking about community-based organization. Because those people involved in those organizations, they know more about the community. They know what is the challenge, what are the challenges to their people. They know how to deliver messages to those people. Those people, they need help also from the other organization who got the knowledge. So like what's going on right now in the Community Matters, as a community-based organization, we are trained by Toronto Public Health. They give us the training. They bring, first of all, the material which is going to be used during the training. So that material, we are, of course, having discussion around this material because we know about our people. So we go through all the material and make changes if it's possible. We are working really hard on that because this is what we're going to use for our community. And then it's our responsibility to deliver the message. So we deliver the message, we follow up with our people. We try right now, for example, that we start our project about cancer screening, and the breast cancer is one of them. We found that we need a tool to achieve this screening. So for that, we create our health passport. In the health passport, there are different questions about general information about the person. And of course, when you answer some questions, we get to know if you need to get screened or no. Age group, for example, and if there is a family history, all that stuff we go through the health passport, and then there is a person who is responsible just to check all the health passport and see if those people needs to be screened. So that time, we have to do something for this person. We just refer the person to the family doctor. She has to see the family doctor because we can't ask the family doctor to do everything or the hospital to do everything. We need to work all together to make this person to get the care from the family doctor and then from the hospital if the treatment is needed.
Mm-hmm. One of the themes in the film that really stood out for me was the idea that women are caregivers and providers for their families and communities. So a lot of these women were the matriarchs of their family, or you saw in the film the matriarch was actually caring for the women with breast cancer. So families are so intertwined and such a big part of some of these cultures. What happens to the family when somebody is diagnosed with breast cancer? And are clinics and hospitals, do you feel, really using a family-centered approach? So when I used to work in a hospital, that was the big word that got thrown around. We have a family-centered approach to care. What does that actually mean? Because I think when we're looking at various cultures and ethnic communities, the family is quite different, and it actually plays a very different role than in a North American-born family, for example.
First of all, when a person is diagnosed with a breast cancer, for sure the family is destroyed because this is the woman. She's the main stone in the family. She's doing everything. She's thinking about everything. So I believe in many families, everything is not as usual. Everything changed. So, and it's really, and for sure if there is kids, so it's really hard that time. So, and the difference when we are talking about this family in Canada or outside Canada, back home it's different because we have this familial support. I have my relatives. If I'm sick and my parents, they are not around, my husband is not, for sure I'm gonna get someone from my relatives or even my neighbor to help me. But it's not the case here. Here, we are alone, we are with our small family. It's the husband and the kids, if there are kids. So, and we are trying just to find some kind of support. in our community, we try our best to provide this support. So I can answer this part from the community. But when it comes to the hospital, I didn't get the experience to know really what's going on there, if the center is really there, if they are really doing their job, if they are really dealing with those families as it should be. But I believe if we miss talking about the culture, for sure we are not going to provide the right service. Because when we talk about a person, there is a context, it's the culture. It's not the religion, it's not the education, it's not nothing else, I believe. It's the culture. Because whatever is your background, wherever, how is your family, the number of persons, wherever where you grow up, it's the culture. I'm family doctor from Morocco. I've been here almost 5 years, but I have my culture inside in my brain. Even if I want to decide something, there is my culture is pulling me and saying, no, you should not do it this way. It has to be this way. So the culture should be there, and we need to take this in consideration wherever we are talking about those centers, those hospitals, those persons who are sick. So, but inside the hospital, I can't answer the question. Maybe Sarah, she knows more. And yeah.
Sarah, what can you answer or speak to that question?
Well, I'll give you guys a funny example about like my husband. Well, he's here today, and I'm sure he will forgive me to mention him because maybe he doesn't understand what I'm talking right now. After I, finished all the treatment, I was still in a bad situation, and also was him. So the pastor from our church is very nice. He asked me a few times to, go out with my husband, have a cup of coffee, chatting. And every time he told me, no, I don't want to go, but I feel bad because the pastor kept offering. So at last, he shouted at me, well, he doesn't speak language as mine, and he doesn't eat food same as mine, and he doesn't have a wife with breast cancer. So what do you think we could talk? So the culture does play a very important role behind all this, even if the caregiver not mentioned, who are experienced. So.
And I know, Sarah, you came to Rethink. When you were diagnosed, you were informally being connected through Sunnybrook. They started because you allowed them to contact you if there were other Mandarin-speaking women. Maybe you can just talk a bit about what that was like and what you think maybe the hospital could have done a little more formally to help with that connection.
Right, because back to the question you mentioned before, it's not only translation. See, if we get some brochure from the hospital or other, the organization, some food we don't eat, truly. So it's all about the culture. And from my experience, now I think the community-based organization or the church, they play an important role in patient caring, provider, the same language background people and same experience to connect those people who are in need with someone who has been there, done that. So I guess it's not only about the service, but also who, deliver the message to the people who need and who provide the service.
Thank you. I have one last question, and then we'll open it up to the audience for questions. Breast cancer is difficult for all women, but what does it mean for Muslim women or women in cultures where the breast is so private? Women are not accustomed to talking about their breasts freely. So how does that impact their need to be proactive in their breast health? What does it mean if they are diagnosed?
So, first of all, when we talk about breast cancer, as I keep saying from the time I started talking, so it's the culture. It doesn't have anything to do with the religion. I'm Muslim. It doesn't mean that my religion is not allowing me to see a doctor. It doesn't mean that my religion want to harm me, and I believe all the religions are the same. So it's the culture, the way, what we have here in our brain, the way we are educated, the way we grow up. So we need to work on that. And I believe that the best way is just when you think about your breast, think as it is your hand, as it is your eye. It's something important that, and you want to really care of that. You want to take care of your breast. You want to take care of your hand. You don't want to get injured in your finger. It's the same thing as the breast. So just whenever, if you have something, go and check, go and see your doctor. The culture, the religion, they are not like saying, no, don't show your breast. And I believe all the cultures are the same. Breast is private, and the best proof is we are, all of us here, hiding our breast. We are not naked, right? So it means that this is something that we don't show all the time. So, and it's part of us. We want to keep it healthy. We want to keep it as it is. So whenever there is something wrong, just go and see the doctor. If you don't want to see male doctor, go and see female doctor. If you don't want to talk to your female doctor, ask advice for somebody who can help you. If you don't understand what the doctor is saying, go with somebody who can translate for you. I mean, all the solutions are there. We need just to work on ourselves. The life is going on with the breast cancer or without, but we want to live this life healthy, right? So the breast, it's part of us. Think about it as it is. It's as the other parts of our body. So don't focus on things that are not really there. It's only in our mind. It doesn't work this way, and it doesn't have anything to do with the religion, with your age, with your color, with your race, nothing. Just this is the way I see it. So
I just want to add a little bit in this one. Like she said, it's like it's all depend upon you, like how to approach and how to go and seek for the health care system. So like whenever like what we can do is from our community point of view, or like from community health workers, at least we can influence those people, like or like giving them the health educations. At least we can ask them to do their self breast examinations. At least like they should think about their health, so that if it's diagnosed early, or like it's in the it's diagnosed when it's like a very small mass, then this disease is cured, right? It's curable. It's not like your life is going to finish now, like now you're going to die. It's not like that. So um, as we don't have any prevention for the breast cancer, we can teach them at least to come to approach the community service. At least go and talk with your friends. If you feel shy to talk with us, or talk with your husband, or talk with your family doctor, at least you can talk with a friend to whom you trust most, or like and it's like one by one, when you make a group, it will be easy for you to communicate with anyone in the community, right? So we can give them at least a little bit of idea, like what's going on your breast, or what is happening, and what in what condition you have to seek for the doctor, or what in what condition you have to go to see the doctor, or you have to go for the screening thing. At least we can teach them, like this is the age group where you have to go for the mammogram, or these are the high risk group for you have to do for the you have to go for the mammogram, and you have to go from the screening test and everything. So it's like at least for the community people, as we are doing in the community matters, we are trying to approach them, we are trying to teach them, we are trying to give the health educations about the breast. um, I think these things also help them to be proactive, so they can
Advocate for
yeah,
themselves.
yeah.
It's so
So they will
important.
come, and at least one day hopefully one day they'll come and approach us, and they'll say like I think I have some problem with breast. Hopefully I'm waiting for that day.
Yeah, for sure. Thank you so much. Yeah, sure. Go ahead, and then we'll
It's-
open it up.
Oh, it's Prija, when she talked about the groups, I believe the self-help groups are really important. So it's kind of having maybe one survivor, and the others are healthy, but it's the age group which is at high risk. So this kind of sharing experience, it's really good to encourage people to go for screening.
Powerful.
Yeah, I believe it's really good, and I believe also studies, they have shown that it's really important to use this self-help group.
For sure. peer support is very, very powerful, definitely. Thank you all so much. I'd like to open it up to the audience if anyone has any questions, comments. Okay, great.
Hi, I just want to thank the ladies on the panel for being advocates of breast health, as well as for being wonderful spokeswomen for their respective communities. My question is, what type of support system can we provide for women who maybe don't have access to the resources that we do here in an urban center, where we have an organization like Rethink that has support groups and things like that? Are there other channels that we can leverage to provide help to women who maybe don't have access to support groups, or maybe don't have access to other women in their own ethnic community to lean on for support?
So I think the answer is like, for those people who don't have access to the resources, it's the resources who have to go to the person. So, and there is a study and there is a big binder about this. It's never screened, gets screened, and it's seldom studied. So it shows that, for example, those Aboriginal and many groups, they were really far away to get these resources. And what happened, it's like maybe in our community, we are working there, we are living in the area, so the access is easy. But maybe one day we can just, in our group, just go and provide the service to this group. This is usually how it has to work, because those people who don't have access, we can't leave them like this. We have the resource, so we can go there. We are like mobile, we can go wherever where there is a need. And I suppose this is how it works in all the systems.
Another question? Oh, there's one at the back. Sorry, I have a hard time seeing the lights in my face.
One thing that struck me in the film was when the woman said that in the back of her mind she thought Chinese women don't get breast cancer. And that whole business about the visuals that we see related to various diseases. And I just wondered how your panelists feel about that. That very often the faces of breast cancer very often don't include women who look like me, who look like some of you on the stage. I just wondered, what's your view of sort of the larger sort of image and messages that go out about breast cancer? Who gets it?
Well, actually, I'm a gene carrier, so my mom got breast cancer like 14 years ago. So from very young age, I have that idea that I might have it one day because I have all the risk factors on me. And I don't think like most of people, even if it came from China, but if like grow up in a big city, we kind of don't have a specific the face on some certain disease, especially breast cancer. So that's my personal perspective.
I think she was also asking, if I may, are we seeing only a certain kind of woman represented with breast cancer out there in the world? Like, is she white? Is she blonde? Are there women of color being represented? Are there Chinese women being represented? South Asian women being represented? Do you see that, or feel that there could be more representation of the many faces of breast cancer?
From my own experience, I seen all the ethnic group being represented, and there's a possibility that everyone could be getting it instead of only one specific.
Right.
Yes. Yeah. I would like to add a little bit, like it's not like some ethnic groups, some Africans, or some black people, or the white people with the cancer. It's any one of us can get this cancer. This is not like maybe like the percentage is little low or little high, but as we are women and we have a breast, that means like every one of us can get the breast cancer. So everyone should be like should think about their breast.
I think we have time for one more question. Are there any other questions? Comments? Oh, we do. Great. There's the mic coming.
This is more a comment. I thought the movie was actually very powerful, and it had great representation of women. And I love the fact that most of the women spoke in their native language. I'm a social worker, and I work in a community health center, and I work with immigrant women, and I myself am an immigrant woman. And I just see this as a powerful tool to be used. So I want to be able to get this access to this movie. So yeah, that's all I wanted to say.
Fantastic. Thank you for coming. Thank you all for coming. Thank you so much to our panelists. We really, really appreciate you being here today. And we hope you'll all stay for the next film. It's Lily. It's coming up at 3:30, and we'll have the director here. So please feel free to stay and watch the next film as well.